Hi, my name is Huiyuan Li. I'm a PD nurse in Hualien City Hospital, peritoneal dialysis room. Today, we are going to introduce the standard technique of peritoneal dialysis solution exchange. Now, I would like to start with the preparation of the necessary items for the solution exchange in advance. First of all, 75% alcohol, paper towels, masks, hand sanitizer, 2 mini caps, preheated dialysis solution. When all the things are ready, we will start to operate the maneuver of solution exchange. Before that, we have to shut the doors, windows, and the air conditioner. If the room might be too hot, we can turn off the air conditioner and the fan 5 minutes before the operation. This allows the air to come inside the room to stabilize for some time and prevent peritonitis from the dust contamination while connecting and disconnecting the tubing. Then we have to wear a mask. We need to cover the nose and mouth when we wear the mask. The purpose is to prevent the bacteria in the nose and the mouth from getting into the gastric and abdominal cavity during the solution exchange. Next, we need to clean the desk. Take 75% alcohol. Spread it on the table. And wipe with paper towel in a concentric way, inside out. This will clean the desk and get ready to do the solution exchange. Next, take out the heated dialysate from the heating bag. Tear the outer bag. Place the dialysate on the table. Prepare 2 mini caps. Take out the transfer set from the patient's clothes. At this moment, we have to wash our hands. Take down ornaments if any. First, wet our hands. Apply the hand sanitizer. Now, practice the standard procedure for hand washing. Rub palm to palm. Rub palm over back of hand, fingers interlaced. Palm to palm, fingers interlaced. Fingers interlocked into palms. Rotational rubbing of thumb clasped into palm. Rotational rubbing of clasped fingers into palm. Complete. Then wash hands under the tap with flowing water. Take 2 sheets of paper towels to dry our hands. This can reduce the number of colonies on our hands. If the sink is outside the door, take the paper towels used for wiping hands to open or close the door. Do not touch anything with hands already washed. Also try to keep our hands above the waist. Then we need to check the dialysate. First, check the expiry date, volume, and the concentration. The solution bag is separated from the drum bag. And then we squeeze the bag for the leaks and seams. If so, we will have to replace with a new bag of dialysate. Check the clarity. Look at printing through the clear side of the bag. Then we lift up the solution bag, check through the light. See if there are any precipitate or an impurity. If so, we will have to replace with a new bag of dialysate. Check the drum bag. It's acceptable if there is a little bit of water droplets on the drum bag, because it's sterilized with the high pressure steam sterilization. If the water droplet is as big as a thumb around the corner of the drum bag, it means that it has been damaged, so this bag of solution cannot be used. After checking the solution bag and the drum bag, we will check the tubing. First, we pull apart the tubing. Move the blue and white clamps within the tubing to around 20 cm area, then clip the clamps. At this time, we have solution and drum bags all being checked. First, carefully pull apart the green loop. Take off the mini cap from the caster adapter. Connect the dialysate with the transfer set. Be sure to keep sterile. Hands and clothes cannot be touched in order to avoid contamination. After the connection, put the drum bag in the wash basin with the smooth side in order to inspect the effluent for cloudiness. Then, hang up the full bag on the drip stand. Open the caster adapter clamp and the white clip of the drum bag tubing and start draining. We can see the dialysate is being drained from the patient abdomen. After about 15 minutes, we milk the drainage tube. See if any bubbles run up within the drainage tube or the dialysate has flowed down. If not, that means the dialysate has been drained. Now, we close the caster adapter clamp. Then we will do the flush before filling. Break the grain flexible and move down 1 centimeter. Then take the blue and white clamps in our hands. Open the fresh dialysate, fill tubing to allow the fluid to enter the drum bag for 5 seconds. After the flush getting filled, clip the white clamp. Then, open the caster adapter to start filling. When the dialysate bag is empty, close the caster adapter. Clip the blue clamp. Remove the drum bag. And wash our hands again. We can wash our hands in the sink or use the dry sanitizer. The same way to have the standard hand washing. Rub palm to palm. Rub palm over back of hand, fingers interlaced. palm to palm, finger interlaced. Fingers interlocked into palms. Rotational rubbing of thumb clasped into palm. Rotation rubbing of clasped fingers into palm. Complete. Check the new sterile cap is not expired and then open the package carefully. Remember to leave the groove surface side down to prevent the mini cap from the slipping off. Now, disconnect the catheter adapter from the dialysate tubing. Immediately connect the sterile cap to the catheter adapter and ensure to keep sterile. Secure the catheter position on the abdomen as being instructed to prevent from pulling on the catheter. The whole process of the solution exchange is completed now. After these steps, observe the effluent is clear, looking for the haziness or fibrin strands. Generally, it's clear and yellowish, and we can see our palm prints clearly. Then we will measure the weight of the drainage fluid. The physician will adjust the prescription according to each exchange drainage amount. Record the amount that we measured. After that, bags should be slit and drained to the sewer and tubing sets. Be cautious when pouring and do not spill the fluid outside in order to prevent mosquitoes from breeding. Now we pour our drainage fluid into the sewer tank and flush down. Then wrapped and disposed of as the household garbage. The whole process of the waste management is completed. We would like to remind all ESRD patients, wash hands carefully whenever exchange the solutions, wear mask, check the dialysate solution, pay attention to the personal hygiene and environmental cleanliness. Also ensure to follow every step and detail of the PD solution exchange technique. I believe you will have a good quality of life during the dialysis treatment.